thank you so much for joining us today. For our audience, would you mind telling us a little bit about your name and who you are and what you do, and then we'll go into some questions.
Hi, Michelle, and thank you for having me on your fireside chat here. I'm Dr. Stephen Soldo. I'm an emergency physician by training, but have had some recent experience over the past years in hospital administration and group practice. We have a medical foundation here in Fresno, California, and I'm the president and shareholder for that group. And I still currently work clinically in urgent cares, and we have a whole network of urgent cares that I'm working at. So.
Okay, terrific. So you being in urgent care, I'd imagine you are seeing or have seen or could see some of the effects of the coronavirus.
Absolutely, particularly on the outpatient physician side, and particularly it will vary from place to place, but in Central California, where I'm located, we've actually seen a tremendous drop in patient volume, which is almost counterintuitive from what you hear on the news, where you hear about hospitals being overwhelmed and full of COVID patients. But one of the sort of side effects of this whole thing is that we have seen a drop in elective, non-urgent kinds of things that people realize that it's safer to stay home sometimes.
How about in terms of, I was mentioning to you before we started recording that, you know, for lay people out there, myself included, I tend to follow the science and view the science. But I also know that when you listen a lot of times to the sound bites out there that are saying it's time to open up, the economic disaster is huge, people want to go back to work.
For example, where they have been hit very hard with the COVID virus, I think it would be very risky at this point to begin opening up unless they're very selective about it. And I think my opinion is Cuomo's doing a very good job, at least trying to be fair and analytical and not have a lot of bias. If you look at an area like ours, we're in California, where the LA and San Francisco area have been hit harder than we have in the Central Valley. It's really hard to say because I don't think we've seen our peak yet, or I don't think we're even close to it where we're at. And I think our peak is going to be relatively mild, hopefully. But part of that, or a big part of that, is people are really doing the right thing for the most part. It's interesting, you know, there's a few people out there that are just going out and doing their thing, but most people are taking it fairly seriously, and even at the great economic cost. Now, there's really, in my mind, and again, you've probably heard this on some of your other chats and some of the news shows, there's really two crises in this country. One is the economic crisis, and one is the medical crisis. The medical crisis is significant, and a lot of people don't realize how significant it can be, even in areas that haven't been hit hard yet. But I think the economic crisis we're just beginning to see happen now. And in my view, I think it's going to change the way we live in the future significantly. And some of that will be better. I'm always an optimistic guy, so I think we're going to see a lot of good changes that come out of this. We're going to see some really difficult times for a lot of people, but if we can get through this and not point fingers at each other, I think we'll be better off and trying to see some changes that are going to be positive for the society.
Oh, that's really interesting. I agree with you. When you talk about changes, one of my questions was, obviously significant changes happening in the hospitals as we speak today. But when we come out the other end of this, whenever that is and however that is, do you think some of those changes will stay? And if so, could you talk a little bit about those?
Absolutely. I think we're going to really expose the dark side of our medical, I call it a system, but it's not a system. We'll expose the dark side of our medical non-system. We really have a fragmented providers and hospitals and so forth. A lot of the hospitals, again, wearing my hat as an ex-hospital administrator, a good hospital will make a margin of 4 or 5%. So now what we're seeing, like at our hospital, if the volumes go down 20, 30% particularly at things like elective surgeries where everybody makes the money in the healthcare system, that margin is gone.
Right.
Now, we're fortunate in our system to have a good cash reserve, but a lot of these small hospitals, particularly
Specialty ones.
the specialty ones, will probably be okay because they mostly do elective paying things. But I'm
Okay.
thinking the small rural hospitals are on very thin margins. And already a lot of them were going out of business. And I think a lot more will go out of business. And I'm also seeing as a healthcare provider and runner for, you know, president for our medical foundation, that a lot of the practices in this town are struggling. Now, some of them have been able to tap into the PPP program. But even with that, I think we're going to see a lot of long-term consequences to the small practices that have been historically the way we have practiced medicine in a lot of areas. So I think we're going to see a lot more consolidation of physician practices and things like that.
Do you think that's a good thing, a bad thing, just a result of it? What's your opinion on that?
My opinion is, I think it's a good thing overall. I think we need systems of care where it's not every man for himself. I think we need a system of care. And in California, Kaiser is sort of an example of that. The downsides and the upside, but they are a system of care where all of the providers, the insurance companies, and the patients all kind of work together. One of the other big things I'll just mention at this point is telemedicine. One of my sort of passions for the last 3 or 4 years has been promoting care given over the internet, and it's been slowly getting better. One of the things this crisis has done is it has allowed reimbursements for telemedicines that were not there prior, and it has allowed for licensing changes where there's some flexibility. So if I'm seeing you as a patient, but you happen to live in a different county or a different state, I can still take care of you. So,
And before you're saying we couldn't because of licensing and or insurance reimbursement? I had no
insurance,
idea.
yeah, it's a huge difference. So for example, just in my little world of the urgent care, we've been trying to get this up and running. We had a very small platform, but we weren't getting paid for it very much. We get a small amount per visit. Now, with the new rules, probably half to 2/3 of our visits are now over video. And the doctors like it and the patients like it.
Oh, we love it. Yes, absolutely. It's so much easier. It's more personal. There's less waiting. You know, the results are immediate. I just didn't realize that this was something that couldn't be done before because limitations that are now opening up. That's
Yeah,
very
and like I said, the physicians like, now, not everything can be done on a video visit. Probably
right.
a half of the visits, you know, as an emergency doctor, if you come in with a broken arm, I can't set it over the video visit.
What's the matter? Can't reach out and touch me?
I can't sew up your laceration or put you back together, but I can usually take a look at it and say, yeah, you better come in and let us see you, or no, you can keep an eye on that for a couple of days and see how it does.
I hear you. What about, you know, America is such, you know, I speak to a lot of people about the way we handling it, the way other people, and they pointed out, which I understand is one of the things about America is we're very unique in the sense that we're very independent. We like to vive la difference. And so this one turns right, this one turns left. It's all okay until we fight each other internally. But with that said, the thought I have is these smaller places that are going to be forced out, going more into a systemized, isn't that taking away their sort of independence and their different way of looking at something for a more systematic way? And are people going to resist that, thinking they're not getting the best information because they're dealing with a system of opinions?
It depends on your point of view. So if you're a small, again, I'm using the medical system as an example. I think that's what you were referring to.
Yeah.
As the medical system, if you're a small provider in a small rural community, it's going to be very difficult to make it. Now, if you're a consumer out there, you may like your old family doctor, and his or her care may be good, or it may be not so good. It's really hard for a consumer to tell. And That's one of the things I've learned over the years. It's very hard for a consumer to tell if they're getting good medical care a lot of times.
Right.
They can tell whether they like their doctor, he's friendly or she's friendly or they're helpful, but they don't always know, is this the right prescription he's given me or the good prescription, or should he be doing this test or not doing this test? And that's where looking at the data and standardization of care, and that's a word we use a lot in the medical community, is you want to standardize to the best practice. So just because I'm a doctor and I like this way of doing things doesn't make it the best way of doing things. And if we can, as colleagues, say this is a better way of doing things, and now we have a standardized way of doing it, I think that will improve care in the long run. And I think we're going to see more of that as we come to the other end of this.
Do you see any of that happening in other countries, more of what you're talking about, where it's been done successfully?
I think in other countries, they already have systems of care. Like I said, we don't really have a healthcare system. We have a total fragmentation. One of the examples I like to use is a lot of folks are concerned about the government taking over healthcare.
Right.
If you look at what the government already controls probably 60% of healthcare. If you look at Medicare, Medicaid, children's funds, if you look at the veterans, if you look at the military, they're already paying for most of it. So, you know, the young, healthy people are the ones that are getting insured typically through the insurance companies because they have jobs and they're still working and things like that. So the insurance companies have a good deal. If you get sick or if you get old or if you have dialysis or medical problems, you get on Medicare and then the insurance company doesn't have to pay as much. So they got a good deal.
Right, they do.
Right.
They do. I think I've spoken to people on this, and there's a lot of fears, not really COVID, but there's a lot of fear I hear people talking about that if the government takes over more without realizing how much they already do, that it's going to cost the individuals at home more in tax than they've ever paid. That what I keep hearing is a major complaint is, I don't want to pay for someone else's care. That's like the number one thing I hear from someone who leans in that direction. How would you respond to that?
It's fairly clear. Money doesn't come from nowhere, so they're already paying for someone else's care, whether it's through their copay because they have insurance and their insurance rates are up. Now they have a higher copay, or plus they're still paying into Medicare. You're still paying for Medicaid, so you're already paying that. And if you look at the total healthcare costs, I think everybody has heard this 1,000 times. What we pay for healthcare in this country is ridiculously high, and mostly because there are so many middlemen. If you look at insurance companies and everybody else who's
broker, the agent,
and if you look at the costs that we pay for doing the billing, like say as a private physician, you have to pay for your billing company, you got to pay the insurance companies, they deny it, so you have to pay your clerical staff to, you know, go back and, you know, dispute their claims, and by the time you get your test that you want it done, it's already double the cost.
Yeah, and you're probably a lot sicker and incurring more costs now.
Right.
How about the other question I have, and this is kind of off COVID, but it's kind of interesting, is somebody said to me, you know, why is it that if someone has Medicaid, they can go in and get something done at a fraction of the cost than someone who's paying private insurance and a higher amount? Where is there the disparities? How is the government not paying for the additional amount without us seeing it?
That's a good question. For a Medicaid patient, first of all, it's not easy often to access healthcare, particularly in our community, and that's true in many communities. So just getting the access. Now, once you're in there, you get everything paid. But it also goes back to your question about whether, you know, are we paying these hidden healthcare costs? As a hospital, the only way a hospital can survive, you can't survive on Medicaid dollars. At the best, you might be able to be neutral on Medicare dollars. So you're making all of your money off the insured patients.
Right.
So if you're paying for your health insurance, you are paying extra for Medicaid and everybody else, because that's the only way your provider will stay in business.
Okay, that makes sense. It's just it's such a complicated situation. Let me just see if there was anything else I should be asking you that I haven't that you might want to share with us before we, close this segment.
No, like I say, it's really a interesting time. I'll call it interesting, but it's challenging, and I do think it's going to be transformational. It's going to be transformational for the economy, for, in my view, for healthcare, not only from the medical but also the economic standpoint and how we reimburse. And I think this is a good opportunity. I always say when there's a challenge, there's an opportunity.
Always.
We as a society have to use this as an opportunity to rethink how we're doing it and to do it better.
I think that's exactly true. I think the problem comes trying to get people of different sides of hearing some misinformation and sort of sound bites to really understand the complexity and that there is a solution. And let's see how we tackle that. But either way, I look forward to seeing where we go.
Okay, well, we'll keep people informed rather than misinformed.
Thank you.